For this assignment, I chose to focus on hospital accreditations and conditions of participation. I chose this topic because I felt that I did not have a solid knowledge of this topic, and I believed that hospital accreditation and conditions of participation is a topic I should have a firm grasp on as I make my way into the healthcare field. There are 6 different types of hospital accreditation organizations. The first part of this presentation, I'm going to go over all 6 of them by defining and giving a brief insight to them. I then am going to define 2 other organizations that I have found to play a significant role in hospital accreditation. The first accreditation organization I will define is the nation's largest and oldest accrediting body. It is known as the Joint Commission on Accreditation of Healthcare Organization, or the JCAHO. The mission of the JCAHO is to improve the quality of care provided to the public through the provision of healthcare accreditation and related services that support performance improvement in the healthcare organization. JCAHO main target areas for accreditation are hospitals, home health, long-term care, behavioral health care, clinical laboratories, ambulatory care, and health networks. The specific type of standards that the JCAHO focuses on are structural, organizational, and patient-focused accreditations. JCAHO is an independent, non-for-profit organization. It accredits and evaluates almost 20,000 healthcare organizations and programs. Next, we'll look at the National Committee of Quality Assurance, or known as the NCQA. The National Committee of Quality Assurance is a private, non-profit organization that assists and report on the quality of managed care plans. The mission of the NCQA is to provide information that enables purchasers and consumers of managed health care to distinguish among plans based on quality, thereby allowing them to make more informed healthcare purchasing decisions. The NCQA is involved in the accreditation process with 53% of approximately 630 health maintenance organizations in the United States. The type of standards the NCQA accredits are clinical and administrative to managed care plans. The next is the American Medical Accreditation Program, or the AMAP. The AMAP was developed by state and local medical societies. Physicians wanted to evaluate themselves and not let hospital administrators, managed care executive, or insurers do it. This program is the first nationally recognized program for individual physician quality accreditation. The mission of this program is to provide a consistent, credible, and convenient source of information on physician quality. The object behind the formation of the AMAP is to maintain a high quality of physician care. Essentially, the program is a voluntary, comprehensive accreditation that evaluates physicians against national standards. AMAP provides the exchange of physician-to-physician information that allows continuing improvement. The standards that are expected are environment of care, credentials, patient outcomes, and clinical process. The targeted area for accreditations are physician credentials and office practices. The next 2 somewhat go together. They are the American Accreditation Healthcare Commission, also known as the AAHC, and the Utilization Review Accreditation Commission, known as the URAC. The AAHC is a nonprofit organization that has issued more than 1,200 accreditations certificates to over 300 managed care organizations. The AAHC offers 9 different accreditation programs for managed care organizations. The mission for the American Accreditation Healthcare Commission is to promote continuous quality improvement and establish standards for the managed care industry. The type of standards that AAHC holds is credential verification organizational standards, workers' compensation, case management, health network, and health utilization. The targeted areas for the accreditations are managed care organizations. The Utilization Review Accreditation Commission, I felt, went with the AAHC because the URAC focuses on the same type of standards in areas of accreditation. The URAC mission is to help organizations transform by developing national standards to improve quality, protect consumers, and improve health outcomes. Both of these organizations provide standards for managed care organizations to improve the quality of healthcare. The sixth hospital accreditation organization that we are going to look at is the Accreditation Association for Ambulance Healthcare, or known as the AAAHC. The AAHC is a private, non-profit organization that more than 1,000 organizations are currently accredited by. The mission of this organization is to assist ambulatory healthcare organizations in improving the quality of care they provide to their patients. The AAAHC provides educational efforts, performance measurements, and sets standards for ambulatory surgeries, birthing centers, urgent cares, and community health centers. The standards that this organization sets are for the quality of care and the quality of these environments. When doing my research, I found that there were two other additional organizations that I felt were vital to developing standards and performance measurements for hospital accreditations. So I thought I would briefly go over them. The two organizations are the Foundation for Accountability, or the FACCT, and the Agency for Healthcare Research and Quality, or the AHRQ. The FACCT does not actually conduct accreditation surveys, but it develops patient-focused measures. It provides a consumer information framework that helps simply inform information sharing, performance measures, and education. These quality measures are meant to be significant to consumers and buyers of the healthcare industry. While the Agency for Healthcare Research and Quality is part of the Public Health Service in the U.S. Department of Health and Human Services. This organization focuses on enhancing quality improvement and cost of containment. One of the things this agency is known best for is developing evidential-based clinical practice guidelines. I felt it was necessary to add a quick overview of both of these organizations because although they do not provide accreditations to healthcare organizations, they provide information and quality to the accreditation organizations needed in order to create good standards. The last part of the assignment, we will be looking at conditions of participation, or also known as COPs. COPs were created by the Center for Medicare and Medicaid Services, or CMS. Conditions of participation is a set of standards that healthcare organizations must meet in order to begin and continue participating in the Medicare and Medicaid programs. These health and safety standards are the foundation for improving quality and protecting the health and safety of beneficiaries. There are currently 75 specific standards that are set in place. These codes are presented in the Code of Federal Regulations. The compliance with the COPs for accredited and unaccredited hospitals are almost exactly the same. From all my research I've done on the COPs, I have found that nurses tend to be affected the most and could potentially be affected by COPs even more in the future. COPs are meant to protect patient health and ensure quality of care, but this can also limit or prohibit nurses from practicing to their full extent of their education and training. Every year there are COP standards get revised and changed if necessary. It is important that nurses are considered and acknowledged as the healthcare industry transforms. They need to be able to practice and perform their duties to the best of their abilities without work restrictions.